Thank you for joining us. I'm Craig Ford. You've heard from national politicians and national experts about the coronavirus, but for the next 30 minutes, we wanted you to hear from people here at home, hear what they have to say about where we stand now with this disease. In the second half of our broadcast, some local mayors will join us to talk about what's happening with their communities during the pandemic. But the first part of our program is with local doctors, local medical professionals who are experts concerning the coronavirus. Joining us on Zoom is Dr. H.F. Mason of Baptist Memorial Hospital, New Albany, or Union County. He is the hospital's chief medical officer. Also with us is the chief medical officer for North Mississippi Health Services, Dr. Jeremy Blanchard. And here with us from MedPlus is certified family nurse practitioner Brandy McCain. Thank you all for being with us today. And Dr. Mason, since we did a program earlier, I figure I would start with you. Where do we stand with the coronavirus as we talk right now?
Well, I think in Mississippi is where we stand, as we are continuing to see increased cases. If you look at the daily counts, even as early as last week, we had one of our highest new case counts, daily case counts since the pandemic started. The last few days that has started trending down, but I think more importantly than that is you can look at the number of hospitalizations that we are having due to the coronavirus, and I think we are heading in the right direction. We are seeing some increased cases, which may be due.
Thank you for joining us. I'm Craig Ford. You've heard from national politicians and national experts about the coronavirus, but for the next 30 minutes, we wanted you to hear from people here at home, hear what they have to say about where we stand now with this disease. In the second half of our broadcast, some local mayors will join us to talk about what's happening with their communities during the pandemic. But the first part of our program is with local doctors, local medical professionals who are experts concerning the coronavirus. Joining us on Zoom is Dr. H.F. Mason of Baptist Memorial Hospital, New Albany, or Union County. He is the hospital's chief medical officer. Also with us is the chief medical officer for North Mississippi Health Services, Dr. Jeremy Blanchard. And here with us from MedPlus is certified family nurse practitioner Brandy McCain. Thank you all for being with us today. And Dr. Mason, since we did a program earlier, I figure I would start with you. Where do we stand with the coronavirus as we talk right now?
Well, I think in Mississippi is where we stand, as we are continuing to see increased cases. If you look at the daily counts, even as early as last week, we had one of our highest new case counts, daily case counts since the pandemic started. The last few days that has started trending down, but I think more importantly than that is you can look at the number of hospitalizations that we are having due to the coronavirus, and I think we are heading in the right direction. We are seeing some increased cases, which may be due to increased testing that we're seeing, maybe a little bit better reporting, but I do think that the hospitalizations is trending down, which is positive.
So, Dr. Blanchard, has the threat diminished, or do people still need to be very concerned about this virus?
Oh, it's a tough question when you ask it that way, because the threat is going to be present until we have the ability to vaccinate, I believe. However, social distancing has allowed us to flatten the curve. And that's what we're seeing in Mississippi. We have a lower prevalence of the virus than, say, in New York or New Jersey, I believe, although we haven't been able to do formal testing in that. The results of our testing would lead us to think that, but it's extremely contagious. So the future of this virus in the state of Mississippi is really in the hands of the listeners. They're washing their hands, they're wearing a mask appropriately, they're social distancing, and they're respecting that this virus is super contagious and caring enough about the other individual who they're around to protect them by wearing a mask.
Ms. McCain, can you give me an idea or give us an idea just how reliable the testing is for this virus?
I personally think that the PCR testing is a lot more reliable. I think what we need to get out to the community, though, is when we do the PCR testing, that they ensure that they are having symptoms for those. If you're not having the symptoms, then the virus may not be detected on the PCR swab.
Now, when you say PCR, what is that?
That is the nasal swab that we're actually doing to test.
Got you. Dr. Mason, can you explain why we keep hearing about it's difficult for everybody to get tested? Why is that difficult?
Well, I think one of the reasons is that when we first started testing for COVID-19, we were testing only symptomatic patients. People who had symptoms or people who had traveled from a zone that was at high risk. And also it was just very difficult at that time to get the testing kits. And as we started seeing production ramping up, it is becoming more readily available to the public. And I think as we start talking about testing asymptomatic patients, you're going to see it's going to be a lot easier for people to get tested.
Dr. Blanchard, as you well know, Mississippi as well as Alabama this week are starting to open up barber shops and hair salons and tattoo parlors, that sort of thing. We know the state is requiring them to have certain standards in place, deep cleaning, that sort of thing. But if I'm going, if somebody who's watching is going to one of those places, what do they need to do to protect themselves? Dr. Blanchard, can you hear us? I'll tell you what, I'll stick with Dr. Mason. What would be your advice to folks going to these various places that have opened up?
Well, when it comes to hair salons and barber shops, one of the first things that I would recommend to people, to clients and customers is to call the salon, call the barber shop, and ask them what type of precautions they are taking themselves to make their customers and their clients safe. Are they wearing masks themselves? Are they taking away items such as magazines, magazine racks so people can't touch those? What is their cleaning policy between customers? Are they trying to do things to socially distance the customers? I would also recommend wearing a mask themselves.
All right, we were going to take a quick break. We will return with more of our WTVA 9 News Coronavirus Special after this. We welcome you back to our WTVA 9 News Coronavirus Special. I'm Craig Ford with our 3 guest medical professionals. Dr. Blanchard, I want to ask you this. I heard this question the other day. Daughter and mother are wanting to meet. Daughter's, we'll say, 49. Mother is in her 80s. Where we stand now, what can the two of them do? I mean, are they just good with the mask? Do they still need to do social distancing? Can they even hug one another? What's your advice?
Well, I think that's a real life scenario, and I'm asking me. The first thing and most important thing is, are they both asymptomatic? If one of them has symptoms, they both should avoid each other. But if they're both asymptomatic, my recommendation would be is they both wear a mask. That the daughter who is visiting the home of her mother, make sure her hands are clean and wash her hands well. And then they really should decrease their contact and minimize social interaction in a close nature. So I wouldn't recommend hugging at this point, which for me is difficult. I'm a real hugger myself, so I recognize the challenges with that, but I think that's the most important thing, is the daughter does her best to protect her mother and yet wants to be present with her.
Ms. McCain, as a medical professional, what's your advice as far as whether people should wear masks in public? We know that businesses, they're required, but just being out and about, and it seems to be a very sensitive subject with people. What's your advice? Should they just make it just general practice to wear a mask regardless of whenever they're going out?
I do agree that it is a good idea to wear the mask when you are out in public, as long as the person that is wearing it wears it correctly, and that would be over the nose and the mouth. If it's not effectively covering the mouth or the nose, then it's not really doing you much good. I would also encourage that before they were to take the mask off, that they wash their hands thoroughly for at least 20 seconds before getting their hands close to their face to remove that mask.
And Dr. Mason, how long can you get by with wearing the same mask? I know it seems like I've heard some conflicting things about whether you could go for a few days. A cloth mask needs to be washed every day. What's your recommendation?
That's a good question, and as you said, there are some conflicting reports. I think that any mask that you're wearing, should it become moist, if it's a disposable mask, you throw it away and you get another one. I would not recommend wearing a disposable mask more than a day. That's my practice. I have one that I have with me, and at the end of the day, I throw it away and I get a new one the next morning. However, should it become soiled or moist during the day, I'll get a new one then. You see a lot of people out there, they're getting creative with sewing their own mask, their cloth mask, and I think that's great. I do think that I would recommend washing those daily, or at least having a few on hand so that you could have a clean one to use every day.
Dr. Blanchard, I know the hospital, North Mississippi Health Services hospitals recently started back with elective surgeries, or some of them did. What is going on? What surgeries are happening now? What's not happening? Can you sort of give us a snapshot as far as where things stand as far as your hospitals?
Sure. So it's continuing to evolve. During the COVID, sort of main surge time, like all other hospitals, we followed the Mississippi State Department of Health recommendation with Dr. Byers, and only did urgent and emergent cases. And then we expanded to elective, with that guidance, which included, and there's a different tiering system, but basically your common elective procedures, short of some endoscopies and really procedures that were very orally oriented. So what happens is when you enter the mouth or the airways, if someone sneezes or coughs, they aerosolize the virus if they have the virus. And so minimizing those, and if doing those, such as putting in a breathing tube, wearing appropriate equipment to protect the caregiver. So now we're doing such things as robotic surgeries and laparoscopic surgeries with appropriate protection and screening of the patient, as well as other kinds of elective surgeries, and we're doing about 40 cases a day now, and feel very comfortable with the safety of for the patient and for the providers, based on everyone wearing a mask and the appropriate cleaning techniques that I'm sure Dr. Mason's institution is using as well. And ours include special ultraviolet, as well as vaporized hydrogen peroxide approaches, and then screening each of our providers as well that are doing the surgeries.
I want to thank all three of you for taking time out of your busy day to help people locally, help us to try to share what we need to do as we continue down this road with the coronavirus pandemic. Thank you all so much. We've got more of our WTVA 9 News Coronavirus Special after this. Welcome back to our WTVA 9 News Coronavirus Special. I'm Craig Ford. We now shift the focus from the medical side of the pandemic to the community and economic side. Joining us are three local mayors who, like many elected officials, are trying to navigate their communities through all of this. We welcome Amory Mayor Brad Blaylock, Starkville Mayor Lynn Spruill, Tupelo Mayor Jason Shelton. Thank you all for joining us. Mayor Spruill, I'll start with you. I know you've had some change in the city over the weekend regarding masks, if I'm not mistaken. If you would, share with us where you were, what changed, and why.
Sure, I'll be delighted to, and thank you for having me on. We were at having masks required for both employees and the public who were frequenting public businesses. So if you went to Lowe's, you went to Walmart, or you went to any of the local businesses, you needed to wear a mask as well from a public standpoint, as well as the employees wearing masks. And we've been monitoring and responding every time the governor changed an executive order. We would then reflect on what we were doing and try to follow or try to mitigate what we were doing and match what he was doing. So when the restaurants opened for in-house dining, we felt like we needed, for clarity, to change our requirement for masks to that would be an area where you didn't need a mask. Obviously, it's going to be a little tough to eat your grilled cheese sandwich, which was what I had for lunch, with a mask on. So just for clarity's sake, we changed that. And then when he changed on Friday to requiring or to opening gyms and exercise facilities, as well as the barber shops and the beauty shops, you can't really exercise. It is not, it's not feasible to exercise with a mask on. So at that point in time, we felt like, again, we were picking and choosing, and where would we, where did this stop and how much further did we go along? So what we did is we dropped the mask requirement for the public and for employees and made it a strong suggestion. And that was part of the reason for that, is because the governor also, in his executive order, provided places to have masks. The barbershops and the beauty shops and the nail salons and require masks for the employees and for the customers. The exercise facilities or gyms are requiring masks for the employees. So there was such a disparity there of exactly how it could be handled that we felt like the governor had adequately addressed it to that point. Obviously, it was a divided vote for us. People are still concerned about the elderly. So one of the things I'm going to try to do this week is work with our local businesses and suggest to them that having masked hours, because a lot of the things the businesses did when this first started was they had hours for the elderly, like early morning hours for the elderly. So I was hoping perhaps we might find a time when maybe a couple times during the day that the those who are feeling vulnerable and not comfortable would be made to feel more comfortable if they had hours when only masks were allowed in. And so that's kind of our effort to compromise and offer an opportunity for everyone to feel comfortable getting back out into the community. So that was the rationale behind that.
Gotcha. Mayor Shelton, for folks who may come to Tupelo, is everything in town similar or mirror the governor's order at this moment? Is there anything different?
Yes, sir. The rules in Tupelo right now mirror those enacted by the governor through his executive order. We kind of got out ahead of this the best we could in the city of Tupelo. Since the governor has began doing executive orders, we've tried to follow what the governor is doing. So that's where we're at right now. I think, as far as consistency, as far as both our citizens and our guests being able to understand the rules, that's what we thought would be best. So right now in the city of Tupelo, the rules in place mirror that of the governor's. What we also have released from our Economic Recovery Task Force Friday was a set of guidelines or recommendations for businesses and citizens too. But those are the recommendations. As far as the rules in place, we're mirroring what the governor is doing in Tupelo.
Mayor Blaylock, what about Amory? Anything different there, or is Amory pretty much following the governor's order?
Craig, we too are mirroring what the governor's orders have been all along, especially this last one. It sort of echo what Mayor Shelton just said. We felt it very important to try to be as consistent as possible across our population rather than try to hodgepodge some things here. It's difficult to get the information out anyway and to change certain things here in Amory that aren't necessarily in conjunction with what the governor has ordered. Would be very difficult to put that information out there, number one, and number two, it'd be difficult for a town our size to enforce that as well. So we have mirrored, just as Tupelo has, what Governor Reeves has put out there for us.
We're going to take a quick break, come back, and want to talk a little bit about enforcement of these orders, as well as the tax revenues, where your communities stand economically. More of this WTVA 9 News Coronavirus Special after this. We're back with our WTVA 9 News Coronavirus Special. Mayor Blaylock, wanted to ask you, what has been your advice to law enforcement in your community as far as enforcing the governor's order?
I think when this all began, even when we put out our first executive order and the executive orders from the governor that followed, has been to warn people first, to ask them to leave if the congregants have been more than what is allowed under the orders, to see if they would voluntarily disperse citations. Fortunately, really not had to occur here in Amory. People have been, for the most part, doing what has been asked of them, and have been leaving areas. If there have been congregants of larger numbers, they have dispersed when asked to do so. So we've been lucky in that regard.
Mayor Shelton, what about Tupelo?
The police have the authority to enforce the orders here. We have issued some citations for various things in violation of the the orders to congregate. Some of the, I think, just one or two businesses, but by and large, we've had good compliance here in the city of Tupelo. But the police, just like any other rules and regulation, have the authority they need to enforce the rules.
Mayor Sproul, what about Starkville? Any issues as far as enforcement? And we may have lost Mayor Sproul, but Mayor Shelton, since we have you up, economically, as far as the city's tax revenues go, do you have any sense as to how much of a hit the city's taking because of the shutdown, the stay-at-home order?
National impact of it is huge. It's going to be felt all across the country, the state here in Tupelo. The general fund of Tupelo, we've already reduced about $2.5 million. We are planning to go up to $4 million in budget cuts because of COVID-19. We're hopeful the Mississippi legislature will be able to provide some relief. I think they're doing all they can and allocating the CARES Act funds. So I'm optimistic with Speaker Gunn and Lieutenant Governor Hoseman's leadership that the municipalities and small businesses across the state will see some relief.
Mayor Sproul, economically, how's the city doing? Mayor Sproul, I think we're having some issues with you. Let's go to Mayor Blaylock. What about Amory? How's economically? How are you doing?
No, sales tax revenue wise for a couple of months, what the impact has been. Of course, we're not expecting there to be a windfall of sales tax revenue come in, especially in a situation like this. However, unlike Tupelo and Starkville, we are a smaller community, and we function off of a lot of small businesses, many of whom we're able to make adjustments. Many restaurants, especially, we're able to make adjustments in the way they do business. Some of our local grocery stores that are privately owned, we're able to make some adjustments and do business. So we're hopeful in that sector that we'll be okay. We do anticipate some pain in other areas in our economy. For right now, our city is able to function quite well. To echo what Mayor Shelton said, we are hopeful on the allocation of CARES funding to be distributed wisely from our state legislature. So we'll know more in the weeks to come.
Mayor Blaylock, Mayor Shelton, Mayor Sproul, thank you so much for joining us for our WTVA 9 News Coronavirus Special, and apologize to them and to you for any technical issues that we had during our interviews. More of our special comes your way after this.